ladies and gentlemen, honoured guests, and especially Her Excellency the Governor of Victoria, might I say it's both an honour and a deeply personal moment for me to stand before you, and we gather to launch this vital initiative led by Musculoskeletal Health Australia. For over 30 years, I have been a surgeon here in Victoria. I've served in an area working at the intersection of science, compassion, and human frailty. And over those years, I've come to understand that the disease which we're all talking about is more than just a medical condition. It is a thief of movement, dignity, independence. It affects not only your bones and joints, but lives and livelihoods. I've seen this not just in the operating theatre each week, but in the everyday lives of my patients. In clinic today, a tradesman whose arthritic knees ended his career a decade too soon. A young woman in chronic pain who withdrew from work and community. A grandmother, once the heart of her family, now confined to a chair, watching life from the sidelines. These aren't just case studies, these are people. And each day I face these stories and they stay with me. Today's event, the 2025 World's Biggest Sit-In campaign, officially launches here as a powerful reminder of these lives. These aren't just symbolic gestures. They are calls to action, to pause, to stand up, and to get moving together. This campaign, streamed live across Australia, is not just about raising awareness. It's about rewriting the national conversation. It's about telling the truth that musculoskeletal disease is not inevitable. It is not a natural consequence of aging. It is not something that we should accept without question or effort. Let me be direct. These conditions affect more than 7 million Australians, more than 1 in 3 of us. From back pain and arthritis to osteoporosis and soft tissue disorders, these diseases reduce the quality of our lives, undermine economic participation, and impose an enormous burden on our health system. The numbers are sobering. Let me share them with you. Musculoskeletal conditions are the leading cause of disability in Australia. They account for over $12 billion in direct healthcare costs each year. Lost productivity, another $10 billion annually. And that doesn't include the cost to mental health, family life, or social inclusion. These figures represent lives lived in pain, days lost to discomfort, and futures shaped by limitation rather than potential. But the most powerful truth is this: we can do something about it. As a surgeon, I have the tools to treat diseases, but as a society, we have the power to prevent it, to invest in movement, in awareness, in education, and in community-led change. That's why this initiative matters. Let me also speak from a very personal place. Both my parents are in their 90s. I visit them over the weekend, and I see that the struggle they endure. I watch once simple movements like getting out of a chair, walking across a room, now take incredible effort. And I see what that does to them, not just physically, but emotionally. That slow loss of independence, that quiet retreat from the world, and I feel it as a son, a doctor, as a citizen. Their experiences, though, is not unique. It's the story of thousands of families across this country, and it is why we must act with urgency. Musculoskeletal health isn't just about joints and bones. It's about mobility, mental well-being, social connection, and dignity. It's about the ability to work, to play, to care for others. And it's about the difference between living and merely existing. So today we say clearly and without compromise, musculoskeletal health is non-negotiable. It must be a national priority. And the time to act is now, not tomorrow, not when the system is overwhelmed, but today, while we can still prevent the preventable. Let's talk about movement. Movement is medicine. Movement builds strength. Movement restores independence. And movement connects us to our bodies, our communities, and to our own sense of self. Yet too many Australians aren't moving. They're sitting at desks, on couches, in cars, and with that stillness comes stiffness, and with that stiffness comes discomfort, and with that discomfort comes withdrawal. That is what makes the Sit-In campaign so powerful. It shines a light on the problem, but more importantly, it invites action. It reminds us that to live well, we must move well. That's more than a slogan. It's a philosophy. It's about embedding movement into our daily lives, our schools, our workplaces, and our communities. It's about creating environments that support physical activity not as a luxury, but as a basic, essential part of living. We need to promote early intervention, encourage lifelong physical activity, design cities and neighborhoods that support movement, provide culturally appropriate and inclusive programs, and advocate for policy that embeds musculoskeletal health into public health strategies. We also need to support our health workforce, our researchers, clinicians, physiotherapists, and community workers who are on the front line every day. They are essential in helping people regain mobility, reduce pain, and reclaim their lives. But none of this can happen in isolation. It requires partnerships. Partnerships between government, community, healthcare, and individuals like us. It requires a campaign like the Sit-In to not only raise awareness, but build momentum. And it requires each of us to take responsibility for our own movement, our own health, and our own role in shaping the well-being of our society. We are the CEOs of our own lives. And as I close, let me say this. We are at a turning point. We can either continue down the path of rising disease burden, lost productivity, and personal suffering, or we can choose a different path, one of prevention, empowerment, and shared action. I know which path I'm choosing, and I hope you will join me. Let us move because it's what we're built for. Let us act because the need is urgent. And let us lead because the lives and futures of millions of Australians depend on it. Thank you.